Hello, my name is Justin Yurt, and this is my presentation regarding evidence-based practice of breast is best. For 9 months, the newly conceived infant is being fed via the umbilical cord all the nutrients, immunities, strength, and energy that it needs in order to make it to that big day. Shortly after birth, the new mom makes the first decision of the new baby's life. Will I breastfeed, or will I give formula? How can we as nurses aid our patients in this decision-making and support them as well? Studies show that nearly all hospitals encourage breastfeeding for at least the first 6 months of a child's life, and then a continuation of 1 year or more. However, it isn't uncommon for new moms to opt out of breastfeeding even mere weeks after giving birth. According to Fulker-Maglaya et al., in an article entitled Implementing a Breastfeeding Toolkit for Nursing Education, women cite lack of support from health professionals. This statement is a shot in the heart of the nursing profession, as the very foundation of the nursing profession is that of being a supportive member of the health team, specifically to the patient. In the article, as the title suggests, they conducted a study where the development of a toolkit was presented in nursing education. Using the ADN students at a community college in the local area, the 3-part voice-over PowerPoint focused on the nurse as being the facilitator of breastfeeding initiatives and getting off to a good start, and ensuring adequate intake, special situations, and support. It was shown that an increase of mothers continuing breastfeeding for longer periods of time when they were with a nurse having gone through the toolkit education. While this is a localized study in this area of the community college, it is implied that duplicate studies can be conducted with similar results. But the question still remains, why the change in history occurred from breastfeeding being the norm to fading away. In an interview with historian Jacqueline Wolf, senior editor of Time magazine Lily Rothman discovered where this change took place. During the Industrial Revolution and the World Wars, women started going into the factories to work, making breastfeeding more difficult. It was then suggested by health professionals that babies be placed on a feeding schedule to help promote the rigid working hours women were now facing. It was later discovered that while feeding schedules can be helpful to an extent, it is the breastfeeding that stimulates milk production. Without that stimulation and a constant flow, the mother's milk supply goes down, forcing the mother to have to turn to other alternatives such as formula. Combined with the ease of formula and not needing to hope enough milk was produced, the formula option became more desirable. As time went on, it was also seen that now there is a lack of education being provided to the patients that would help with the continuation of breastfeeding for the time of the baby's life that it benefits the most. Since formula feeding was becoming the new norm, why would there be breastfeeding education? Something had to change. Regarding benefits in education, this is probably the best possible course of teaching the patient. What are the health benefits for both mother and baby? You will see in the poster that there are many beneficial health outcomes near the bottom of the poster. Highlighting a few for the mother, health specifically the reduction of risk regarding diabetes type 2, cardiovascular complications, breast cancer, and ovarian cancer, staying off ovulation, and it'll also help with uterine contractibility. For the baby, breastfeeding helps with hormones, proteins that are necessary for growth, immunities, metabolism, which all ultimately lead to a healthy weight status for a growing baby. This topic is so heavily stressed today that even the Surgeon General made a call to action for nurses to support breastfeeding. This can be seen in the top right corner of the poster. I'd like to draw your attention to action number 1. It says for nurses, and it says it all, give mothers the support they need to breastfeed their babies. We have to give our patients support. In conclusion, nurses need to first educate themselves and support the mothers and families of the newborn. There may be special situations where breastfeeding is not possible, and we as nurses should be aware of these contraindications and ultimately still be that supportive individual for our patients. Thank you very much.